thank you all for coming. And I am Brenda Siegel. I'm a candidate for Lieutenant Governor in Vermont. And Medicare for All is an issue I have been working on for many years. I was a huge proponent of Act 48, which was basically a Medicare for All or a single payer system in Vermont that has passed but not been funded. And so I think that we're reviving that a little bit in Vermont, and I am on board to work on that with folks, whether we come up with a statewide, a state plan or a regional plan. And this issue has always been of the utmost importance to me, and we'll get into this later, it certainly grew in importance to me as many years ago when I overnight became ill. I was an extremely healthy person and overnight became ill, which can happen to any of us. And I was very cognizant of the fact that without my health insurance, I would have had a very big challenge getting out of that. So we're going to talk about that later. Right now, I want to introduce you to our panelists. We have Mary Garish, who is here, and I'm going to let her, and then we have Tanya Wiachowski, who's a candidate for State House in Chittenden 8-1, and I want them each to just give a brief introduction of themselves. So Mary, go ahead. You have to unmute.
Okay, thank you. Now I'm unmuted. Thanks, Brenda, and thanks for having this forum. My name is Mary Garish. I live in Bennington, Vermont, and I've been active in the human right to health care for many, many years, and became first aware of it when I was young because my dad, I grew up in the Detroit area, and my dad and two other doctors actually founded the first free clinic in Detroit back in the 40s. My mom was a nurse, and neither one of them thought that anyone should have to go without health care because they couldn't pay for it. So you can kind of get where I am coming from. And certainly I was also very active in the passage of Act 48. And I remember when Medicare was passed, how people were upset about that because they thought that that was just too much and it wasn't going to work. And now all we hear is people saying, don't touch my Medicare. So what we would like is to have an improved Medicare for all. And I say improved because we all know that the current Medicare does not cover very many things that people need. It also does have co-pays, and we would like to do away with those. So basically, I will be talking more about this, but basically I would like to enlist everybody to be a healthcare warrior during this fight. And now more than ever, where we see people, we know people are literally dying all the time anyway for lack of healthcare, but this pandemic has brought it to light. And we, as the people of the United States who care about each other and who care about our society, need to actually do something about it, and now is the time. And with that, I will yield to the next panelist.
Hi, I'm Tanya Wiachowski, and I live in Essex, Vermont, and I am running for state representative in Chittenden 8-1. But long before I thought that I could make changes in government, I was an activist, and I really cut my activist teeth in healthcare advocacy. Having lived in countries that have universal healthcare as a child, and also facing the detriments of being someone with chronic illness in our current healthcare system, I have many experiences and stories with how the system doesn't meet people's needs. I'm also a social worker, and so I work with people every day who are skipping appointments and skipping medication because they can't afford it. And my job is to work with them because I similarly believe that everyone has a right to the healthcare that they need, regardless of their ability to pay. And in our current flawed system, I don't get paid unless people have health insurance or can pay me. And so it's this really difficult place to be. And I will always make sure that people can access what they need. but we have to do better. We are the only industrialized nation in the world that doesn't guarantee its citizens healthcare. And what we're looking at right now with a global pandemic is how much that is failing us. We know that so many people die and so many people are financially ruined because they had the audacity to get sick every year in this country. And we're watching that just sped up because of this pandemic. And so I have fought for all of my adult life for healthcare and realized the many intersections of our really flawed healthcare system.
Okay. Thank you, Tanya and Mary. I am really grateful to have you both here. Both of these folks have been major healthcare warriors. Mary has gotten arrested on account of it a few times, and that's what we need to all be. We don't have to choose to be arrested if that's not what we want to do and what we can do. But we do need to all fight for it, because I'm going to tell you just a brief story. So there was a young girl named Alexis Gialella, and Alexis Gialella was my best friend's niece. Is my best friend's niece. She was 14 years old when she was diagnosed with cancer, and in the middle of her dying, when she was 15, her mom reached $1 million in medical bills with insurance. Her mom did not have that kind of resource, and it is atrocious that we are living in a system where someone like Alexis, her mom, could be left with $1 million in medical bills for the pain of watching her daughter die. So as I learned about that many years ago, I created a childhood cancer awareness project. I did it through my work with a pre-professional training program for modern dancers. And we went around doing fundraising with hospitals around New England on working on that issue and telling the story of Lexi and of her parents. I have to say that it was a very short time in relative time between when she was diagnosed and when she died. So between when she was diagnosed and when that bill reached well over $1 million. And meanwhile, again, as Tanya said, the doctors are not getting paid if the person does not have insurance. So not only is the issue one that we should have health care because it's a human right, but also we're asking doctors to shoulder a burden and hospitals to shoulder a burden when someone does not have insurance, because the majority of doctors do want to treat people regardless, and some are left in terrible positions. And so if we want, right now we're seeing shortages of doctors, shortages of nurses, shortages of equipment, and people who don't go to the doctor because they cannot afford the healthcare bill. So, which has created a reluctance to get the treatment you need or the testing you need, and as we can all see, a pandemic that is causing us all to be home and not be able to leave, and causing our economy to crash, which we'll get to in another town hall. But the global problem of the United States not having Medicare for all system when we are the wealthiest country in the history of the world is unbelievable. And we really need to get to a better place. And that's why I invited Tanya and Mary on. I want to, on the note of healthcare, I want to just, and we're going to do this at the beginning and the end, I want to just put up the links of all the statewide resources. It's a Google Doc of statewide resources around COVID-19. And also, Jacob will put it on, so it'll come from Jacob. And also the link to our statewide mutual aid. I don't know if Tanya included the Essex mutual aid. No. Okay, so our statewide mutual aid, we will get you to Essex. If you're from Essex, we'll get you to Tanya and her statewide and her Essex mutual aid. And I'm also just going to put real quick before we continue, I mentioned this in the beginning, so is the donation link for both Tanya and I, who have joined forces in fundraising right now. And this is an incredibly hard time for people to raise money, and especially if you're a progressive candidate who does not believe that it is the right time to be making phone calls about fundraising. It is right now, we have to be helping people. And so we are asking folks to donate $15. And if you're someone who's fortunate enough to be able to do more, please do more. So back to our scheduled programming. We need healthcare advocates in office, and we need activists and advocates to be at the State House in their local communities. So wherever you are, however you can fight this fight, we need you in it. So it doesn't matter if you are someone who can only do it from home, we'll help you find a way. It doesn't matter if you're someone that can only do it in your local community, we will help you find a way. This is a fight that's for all of us. And believe me, everyone sitting here, including myself, is someone who does not have endless resources or even enough resources, and we have found those ways into the fight, and we will help you find them too. So I will turn it over to Tanya to tell more of her story, and also to tell us a little bit about the work she's doing, and later on we'll get to how we pay for it, because I know that question is going to come up.
Thank you, Brenda. I also just want to add that the Vermont Health Connect has reopened open enrollment for anyone who may have lost their health insurance due to job loss from COVID-19. And you may be eligible for Medicaid or subsidies for health insurance. This is one of the fundamental flaws with our system of having healthcare tied to jobs. Here we are in a pandemic. People are losing their jobs because our economy is crashing, and they need healthcare more than ever, and yet they're losing it because we've linked that to people's employment. So if you do need to access healthcare because of job loss, you can go to the Vermont Health Connect, and they will help you navigate that system, flawed as it may be. So a little bit about what brought me into healthcare activism is I graduated college before the Affordable Care Act. And while the Affordable Care Act has undoubtedly saved my life because it made it so I couldn't be denied coverage due to pre-existing conditions like I was when I graduated college. I finished college, I came off my parents' insurance, I got a job, I did all the things I was supposed to do, and I went to apply for insurance, and they said no due to my pre-existing conditions, due to the fact that I was asthmatic and I had anaphylactic allergies. I had this lengthy medical history that was no fault of my own. I was a child and went to college and then couldn't get insured. And it's not enough. I'm currently one of millions of underinsured Americans, which means that I have health insurance, but I can't really afford to use it due to high deductibles, high copays. And I continue to have chronic health conditions, including anaphylaxis or severe allergies, which requires that I use epinephrine. And so 3 years ago, a pharmaceutical company arbitrarily raised the price of epinephrine over 400% overnight. And soon after that, my health insurer took that medication from being a tier 1 medication that cost $10 to a tier 3 medication that was now over $500. And since that time, I've had over 40 reactions, which is over $20,000 in epinephrine. So right now, every EpiPen in my home is expired, and my life is at stake because a company arbitrarily decided to put their profits over my life. Every single year, over 500,000 Americans go bankrupt because of medical costs. And I am a social worker, and as I said earlier, I see the impacts of this every single day. People who can't afford their deductibles, can't afford their copays, so they don't go to the doctor. People who ration medication and hope that they wake up the next day. The medical industrial complex in this country accounts for close to 18% of our gross domestic product, more than any other country, and yet our outcomes are much worse. We see declining life expectancy, increased maternal and infant mortality. These aren't great statistics. We have some of the worst statistics, and yet we pay a lot more for them. So it's really past, for my own personal reason and the hundreds of thousands of people who go bankrupt, the 87,000 people who clearly die because they can't access healthcare. We owe it to ourselves and to all of them to fight for a system that makes sure everyone gets what they need, to fight for a system where people don't become homeless because they got sick, where people don't lose their entire life worth because they got cancer, and where people don't have to use expired medication and hope that they don't die. That's the world that we live in. It's not the best health system. It's not even a civilized health system. We have to stop allowing Americans and anyone to be a casualty of the medical industrial complex's greed. And so what do we do to hold the pharmaceutical industry and the medical industrial complex accountable to us? The answer is that we fight back, and we come together, because these types of changes do not happen because some benevolent pharmaceutical industry person or a benevolent person in Washington decides to grant them to us. They happen because we rise together and we demand them.
So this, thank you, Tanya. A lot of what Tanya said is exactly why I am in this fight. And I think that we all have to be willing to share our stories. And I still remember the first time I shared my story. I shared it in Bennington, I believe, actually. And before that, I'd fought the fight, but not talked about my own personal story. A little known fact that about me is that I actually don't love sharing my story. You wouldn't know that because I am now willing and practiced at it. But I fought this. But it's so important, because hearing these stories of everyday people that you are unaware have had these health challenges, because from an outset you don't see it. That's extremely important. And not only that, but hearing about the fight that regular people put on. And as Tanya said, nothing has ever changed because it changes from the top down. Everything changes because we say it's time for it to change. We have the ability to make this fight happen. And with folks like you, we can get this done. And I know that we can regionally. I think that would be ideal. If we have to within the state, I know that we can as well. And so I'm going to turn it over to Mary now as well.
Thanks, Brenda, and thanks, Tanya. And I obviously agree. I'm so sorry, I dropped my phone. I hope that didn't kill everybody's ears. So I obviously agree with everything that both of them have said. And I would like to try and summarize it by saying that let's start off acknowledging we do not have a health system in this country. We have a for-profit industry, and that industry is composed of corporations such as insurance companies, medical device manufacturers, and pharmaceutical companies who care nothing about people, but only about profits. And unfortunately, one of the big things we need to overcome in getting a single-payer, universal healthcare system in our country is that there seems to be, in most people's minds, an equal sign between the words health care and health insurance. And actually, as we've all just heard, and as we all know, that is absolutely the farthest thing from the truth. And in fact, it's very interesting because I've been fortunate enough to be in Geneva at the United Nations advocating for the human right to health care in the United States and asking the Human Rights Council to tell the United States that we needed a healthcare system. And the other healthcare advocates there, when we were talking about we don't have a healthcare system, we only have health insurance. And they said, well, we do have the ACA. And we said, yes, we do. And it's much better than what we used to have, but it's still health insurance. It is not health care. And it was like a light went on in everybody's head. Oh, yeah, there is a difference. Yes, there's a big difference. That's why we have the worst maternal mortality rate of any industrialized country in the world. And it is not because we don't have gifted medical people in our country. We have some of the most gifted medical people and wonderful research facilities in the world. The problem is that we don't all get to use them or take advantage of them. Unlike other countries, I might add, some of which who have universal health care and are smaller than the state of Vermont, actually fly people to the United States and pay for them to get needed unusual surgeries or treatments that are available here. And yet, those of us who live here in the United States, even who are citizens, and certainly those who are not citizens don't get to take advantage of those things. And this is because we have privatized our health. We have allowed corporations to profit off of our suffering and continue to allow them to do that. Now, the big problem is always that people say we can't afford it. So I ask you, what is a human life worth? I don't have a dollar answer for that. And I challenge anyone to give a dollar answer for that. It's worth enough that we should all be interested in making certain that every person that lives in our country gets the health care they need. And for those who say, what about the negative effect on our economy? No, I think other countries have showed us that that is not going to happen. All right, so we may have to pay more in taxes, but if you look at what we're paying in premiums, co-pays, and deductible, which on the average for a family of 3 is approximately a $5,000 deductible, about $15,000 in premiums, and God knows what in co-pays. And there is no way that our taxes under universal health care are going to go up to that. So in other words, the individuals in our country would actually see a net increase in income by the raising of the taxes for healthcare. This is one thing we need to do. And we need to get the pharmaceutical companies under control. We need to control them just like every other country does, with mass buying and not letting them collude to increase prices so that they can profit off of people's deaths and suffering. I'm sure everybody here knows that healthcare debts are the largest cause of bankruptcy in our country. And that was before the coronavirus. And people and employers cannot afford to provide healthcare anymore, even though they would want to, because the insurance companies increase their rates so dramatically every year, 10%, 15%, 20%. And they say that it's because their costs go up. Well, their costs go up because their profits go up and they need to pay their shareholders. And their costs go up because of the literally billions of dollars that they spend with the pharmaceutical industries in lobbying our federal government not to control them. And I'm not sure if I'm taking up too much time here. So I want to tell you that there are stories upon stories, from the simple story about me and my tooth that I can't afford to get pulled, but which is broken off at the root, which continually abscesses and causes me to become very ill, which is dangerous because I have multiple sclerosis, which, by the way, I could not afford my injections for, but for my neurologist having secured funding for me. Even with Medicare, I couldn't afford them. And that tooth, with the infection, there was a time when my jaw was just swollen out to here and I had a fever. And my doctor, who all they had to do was prescribe antibiotics, couldn't see me because I didn't have the copay. So they told me to go to the emergency room. Do you know how much it costs for me to go to the emergency room? And I didn't have to pay it, thank God, but somebody did. And my guess is it's the taxpayers of the state of Vermont. It would have been a lot cheaper to let me go get an appointment and go get those antibiotics. And then we have the really drastic cases where people with terrible cancers are prescribed medications that their insurance company doesn't approve, despite doctor after doctor after doctor approving them. And we all know that the insurance companies have an actual policy for their adjusters to initially deny claims until the person appeals several times, because the hope is you'll get tired of it and you'll stop and they won't have to pay. Well, I know several people whose permission to get the cancer drugs came after their spouse or significant other passed away from the cancer. This is not okay. This is something we can do something about. We are the people, and our officials work for us, and it's up to us to put into place a system and get rid of the for-profit mechanisms that currently take place. So I'll stop there. I'm not sure. I probably talked more than my time.
Thank you so much, Mary. Well, I think you have a wealth of information, so I think it's all really important. I want to talk a little bit about the money piece, but I also want to just tell you a little bit about my story. So I was 34 and athletic. I was a choreographer and a dance educator, a cyclist, a runner. I was an executive director and administrator. I worked constantly in many jobs, and I ran nearly 5 miles every day. One day in December of 2010, I went to the gym to run, and I ran 5 miles. 2 days later, I returned and could not make it even a mile. Within a month, I was having trouble eating and was holding on to walls to walk. I am currently the only parent of an 18-year-old. I have raised him on my own. He was 8 years old, and who I was to my son at that time changed forever. Overnight, our lives had changed in a very difficult way, and many of you that know my story know that that's not the only or last time that has happened. And I had incredible health insurance with Medicaid backup due to my personal financial difficulties. Well, it took many months and several journeys to the Cleveland Clinic in Ohio till a doctor finally figured out what was going on. And though there are small pieces of my illness that still remain, I am in good health now. And most parts of my life have been come back. I cannot run 5 miles anymore, just for reference. So I take a medication every time I eat food turned out that I could not digest the food that I was eating. And so therefore I had lost a ton of weight, and I was losing all of my energy and my ability. And that's why I was struggling to walk. And I was nauseous all the time, so it became hard to eat. I get to stop being sick. I get to not be sick and be healthy. I get to be someone who can run for governor and then lieutenant governor. I get to be someone who runs a major dance festival. I get to be someone who is a mom to her son because I have health insurance. If I didn't have health insurance, my medication alone would cost in the neighborhood of $18,000 a year. That's just for that issue. And that doesn't include the tens of thousands of dollars in doctor visits, emergency room visits, and testing that I got for many years in a row to make sure that I would be this person today. It also doesn't include the work that I lost in that time, or when I felt paralyzed or scared to move forward due to my health. But before I was sick, I hardly ever went to the doctor. I mean, like, I really never went to the doctor. I felt fine. I was healthy. I believed with all my heart that there was no way I would really get sick. I lived a healthy lifestyle. I exercised. I had never done anything that invites illness. I mean, I understood why I needed health insurance. That's why I had it. But I had an emergency. I had an emergency surgery. I'd had other small procedures in my life. However, I had never really gotten sick. Thank God I had health insurance when I did. There are not always signs that you are about to get sick. There are not always indicators that your life will change overnight. For many of us, our lives overnight change for no explainable reason. I want to say that again because right now, that just happened to all of us. For many of us, our lives overnight, for no explainable reason individually, change. This is what's happening right now, globally and throughout our country, happens all the time to individuals. We just don't always notice because it's not all of us at once together. We're seeing the need for universal health care right now because of that. So when let's just say a bank, when you're allowed to leave your house, and when I'm in a bank and I hear people feel excited that there's no longer a penalty for those who do not have health insurance, and thank God, because that penalty was killing me, I think, my gosh, I hope you don't really get sick suddenly. I think how foolish it is for us to believe that that will never happen to us. I might not have thought that before 2010. When I'm standing, I feel for people that feel that way because it is a real economic burden, health insurance. I feel compelled to make it known that we all need health insurance. How many of you out there participating tonight, watching on our Facebook live stream or attendees here, how many of you know someone who's has gotten cancer? How many of you know someone who suddenly died of a heart attack? How many of you are fearful today that you might get COVID-19 and that you need health insurance to survive that? Because even if they'll treat you without the health insurance, which in Vermont you can go to an emergency room, you still will be landing with a big bill. Without health insurance, I wouldn't be okay. I would not be able to afford health care. And if I wasn't okay, then I would not be able to work at all. Everything would be more costly and more expensive for folks out there. I think that it's extremely important that we remember that it is really on all of us. So when we start talking about cost, one time I did the math and it was somewhere in the neighborhood of $50,000 a year, my health insurance, my health care cost when I was very sick. The rest of my life, it cost almost nothing, right? So would I have, as a low-income single mom who was the only parent of my child, really sought that health care if I didn't have a way to get it? I don't think I couldn't have. I may not have found anyone that could have diagnosed me. And it was because of that healthcare. So what I think is really important is that we remember the astronomical cost. So even if it's not that you care about the humanity of each person out there, I very much do. I very much care about the morality and the humanity. But even if it is that you don't care about you don't agree with me about that you think that that we all should take care of ourselves, it's, just all of us for ourselves, which I think we're seeing right now doesn't work. But even if we think that, I ask you, I bet you agree with me that I bet you agree with me that you want the cost to go down, the cost burden on all of us. So when we ask how are we going to pay for it, not to mention the fact that we always have enough money for war and corporate bailouts, like we always can afford that, but we can't afford helping people. But not to mention that, we're spending more money right now than we will if we don't do this. If we do this. And what I think is really important to understand, important for Vermonters to understand, is that while, yes, there will be a tax, there will be more money in your pockets, because the majority of us do pay for health insurance. And we will pay less. We will not have that cost burden. We will pay a percentage of our taxes. Yes, that will be there. But the overall cost between co-pays and insurance will go down. And how we pay for it is really something that Tanya is really prepared to talk about right now. And so I will pass it on to her, but really share with you that this costs less. This costs less. It's a strategic investment. Many of you know that strategic investment is a word we hear in business all the time, right? Strategic investment is something that you make so that in the long term, you're spending less money. That's what this is.
Thank you, Brenda. This is Tanya. And the cost analysis is twofold. There's individual cost. And so I'll give you my own personal example about individual cost. So under one of the current Medicare for All proposals, which is a 4% tax on income over $29,000, and complete coverage, no deductibles, no copays, no co-insurances. You go to the doctor, you get treatment, you give them zero money. My family would pay $2,200 more in taxes, but we would be saved the $18,000 of out-of-pocket expenses that we currently pay into our healthcare. And so the math is pretty clear. We're saving a huge amount of money by switching to a single payer system. And so what gets skewed a lot when we talk about this is we talk about increased taxes. And that's true. My taxes will go up by about $2,000. But what we don't talk about is that I will save $18,000 in copays, deductibles, and out-of-pocket premiums and out-of-pocket expenses. And I'll be able to go to the emergency room after an allergic reaction and be treated and not worried about the $5,000 bill that comes afterwards. And so those are our individual expenses. The larger societal expenses, Brenda is right. What we're doing now is much more expensive than what socialized or universal healthcare would look like. The real point here is that we can't afford not to do this. Under one economic study done at UMass Boston, they used a similar 4% tax model. They trained all workers who would not have a job because of the shift in how we do healthcare. So they used training money to make sure that they still had a job. And we saved almost $600 billion a year under that plan, which is a pretty astronomical amount of money. Currently, it is estimated that 1/3 of our healthcare dollars go to redundant administrative costs that would be eliminated under single-payer healthcare. And when we talk, sometimes we hear people talk about a public option. And the problem with the public option is that those administrative costs are not eliminated because you continue to have multiple insurers. So that 1/3 cost savings doesn't happen unless we move to a model that is everybody in, nobody out. And the other piece is that when everybody's in and nobody's out, the risk is spread across the entire pool. And so people like me, who might be a little bit more expensive to the system, are balanced out by people who currently aren't paying into the system at all, probably because they're choosing not to have health care, but are relatively healthy and don't need much medical care. People like Brenda was at one time. And when we put them all in the same pool, it balances it out so that there is no one burden. We also can allow people to access primary care, and we know prevention saves money. As Mary pointed out, if she was able to get the health care that she needed early, she wouldn't have ended up in the emergency room, which is much more costly. And when I said earlier, because it is really important to me, the human cost, that's actually the most important thing to me, but I know that for many out there, the economic cost is really important. The human cost is so underrepresented. When we say that roughly 87,000 people die each year because they couldn't access medical care, it's obvious stuff like the person who couldn't use insulin and so they died because they couldn't afford it, or the person who we just heard about the other day, the teenager in California who was turned away at urgent care because he didn't have health insurance and died of coronavirus. That's what we're talking about when we talk about those 87,000 people. We're not talking about the person who got diagnosed with stage 4 colon cancer because they couldn't afford preventive care that would have prevented them, that would have caught that when it was polyps and precancerous. So that number is much lower than it really is. And that preventive care would save the system money. So there's multiple points of cost savings. And another huge point of cost saving, one of the places that it's estimated we could save about $200 billion a year, is with pharmaceutical companies. We're the only industrialized nation that does not allow for our Medicare program or our socialized medicine programs to negotiate directly with pharmaceutical companies. In this country, pharmaceutical companies decide what you're going to pay for something and you pay it or you die, which is what my experience was. One day I showed up at the pharmacy to pick up an EpiPen and it cost me $10. And a month later I showed up and they told me it would be $565. And there's nothing I could do. That's perfectly legal. We pay significantly more for pharmaceuticals than any other country because they don't allow it. They do not allow price gouging. I can buy insulin in Canada for 10% of what it costs me in the United States. And so all of these pieces combined, we save significant money. So when people throw around numbers like $32 trillion over 10 years for Medicare for all, what they're not telling you is that what we're doing now costs over $40 trillion over 10 years. And there's now 22 different studies done by people across the political spectrum that show that this plan saves you money and it saves our system money.
So I want to take a minute, first of all, to just remind people that if you have any questions, please, there's a little raise your hand feature, raise your hand or type them into the chat. We will bring people up to ask them directly, and then we'll remove you as a panelist afterward, but so that we can actually see the people that are here. If you don't want to do that, let us know and we'll just read the question. If you're on the live stream, then type in the question, and Jacob, my field director, Jacob Elpern, he will make sure that we have the questions, and he is monitoring that. If you did a watch party, we can't necessarily see the questions as they're happening, just so you know. In addition, if you are someone who needs the interpreter, who we want to, again, thanks for volunteering, and also mention that she's my mom. And if you're someone that needs the interpreter, just type into the chat. Everyone has to type into the chat when they ask a question, but just type into the chat and we'll bring you up so that you can actually sign in your native language and ask the question that way, unless, again, you want to do it in the chat, and then my mom will interpret it for you. So we're really grateful for the attendance tonight. It's really incredible to see people out there, but we really do also want to hear your questions, because this is a town hall, and we're going to take a little break to ask for anybody that wants to ask any questions about anything we've said so far, or curiosity that you're having right now about this. In the meantime, I want to remind folks that you can share our live stream or share this link on your page, and people can join. If you're able to make a contribution, we'll share that link again, and it allows us to keep doing events like this. And we will tell you a little bit about some other events that we're having as well while we're waiting for questions to come in. And we are, while we're waiting for questions to come in, we have started some respite events. Some things that are just a way to get away from all of this that's going on. We felt like it was really important. So Tuesdays at 4, we have Cooking with Ajna. Ajna is my son. And tomorrow he is making, I cannot remember what he called it, but he is making a very incredible breakfast that he makes himself. I'm not totally sold on it, but he told me I have to try it. And then on Thursdays, at 2, we have tea and conversation, and that's really for me to get to know you folks. That is a campaign event, but also if you just want to drink some tea with us, that's great, or whatever you want to drink in the afternoon. And then at 4 o'clock, on that same day, we have a homeschooling parenting support group. So we're really getting on and chatting, sharing resources, being like, oh my gosh, this is so hard, which again, I'm homeschooling as well, and it is so hard. So that's there as well. And then we have other fun activities going on. And then next week, we have an overdose crisis meeting on Sunday. So if you're interested in that, you can learn about that. So if anybody does have any questions, we would love to hear them. Okay, David has a question. We're gonna unmute you, and if you want to turn your video on, we can see you, and you can ask a question.
Okay, thank you. Yeah, I don't have a camera hooked up to my my computer here, so I'm kind of the invisible man here. Let's see, a comment and I guess disguised as a question, but then a sincere question also. Back around 2011, Bernie Sanders, along with members of Congress, authored a report that showed that way back then, if you simply took all the amount of money that the federal government spent on healthcare through its multiple systems, we have at least 5 of them, and divided it by the total population of the U.S. back then, it was almost $10,000 a person. $10,000 a person that the federal government spends on healthcare at that point. That was more than enough money to pay for some level of universal coverage. And I come out of emergency medicine myself, healthcare professional. When there's also a big difference between charges and what you actually get paid here too. So that's another thing that needs to be reconciled in whatever happens. So the real question is in running for office, what kind of work or effort do you see yourself making or advocating for to reconcile the issues around duplicate systems of care and forcing a redirection into one system? Are there some concrete steps that you propose?
So I have been waiting actually for, I know that Right to Democracy is working, I think, with the Workers Center on on a new proposal for a Medicare for All system in our state. and perhaps it's regional. And I am going to be sitting down and learning about that as soon as it's complete. And likely, usually as these proposals go, I find them to be really strong proposals. And I think we're stronger when we work all together on these issues. And so I'm really I'm looking forward to sitting down, especially because the Worker Center was a huge part of Act 48. I think it's important to not only honor, but work with them on the work that they're doing. And so personally, I am looking forward to that moment. During my governor's race, said that we should be doing a regional plan and that it should, including New England and New York, and that then we would have more of the cost would be spread out in a broader spectrum than just Vermont, and that would solve some of the fear that people have around the tax increase. But I also said if we can't do that, then we should do something here, either in Vermont alone if we need to. So I've been disappointed that not even universal primary care has moved in the legislature. And so I think it's time to just bring back what we want and what we need in order for people to be okay in this state and in this country, and work on that. I know that there's incredible research going on in the Rights and Democracy and Worker Center plan. And so before I come out with my own, I want to see theirs, because if I support that, I think that's where the people power is. And I think it's going to take people power to change it.
Hi, this is.
I don't know if that answers your question, but feel free to ask. I'll let Tanya answer, and then feel free to ask either of us questions.
Yeah, this is Tanya. As I'm also running, I'm happy to answer, and this is really where I cut my activist teeth. One of the challenges that I have when we invest political energy in incremental half changes is kind of what happens with Act 48 can happen. So we say, look, we did a thing, and then the political energy to push through and do the rest of it doesn't happen. And so there's been a real lack of political energy around healthcare. And we do have a law on the books that says in the state of Vermont, healthcare is a public good. And yet we haven't funded it and we haven't done anything with it. And the activist community is really split. There is a group of people who really think that the way to get there is universal primary care. There's a group of people that thinks that the way to get there is with a regional plan. There's a group of people that thinks that we can do it in the state of Vermont. And the reality is that we don't really know. The energy into doing the studies and getting the information on what will work hasn't happened. And Vermont isn't the greatest risk pool. We are a small state with 2 large borders and an aging, therefore probably sicker or more in need of healthcare population. And I'm not saying it can't be done, but we are not going to do it unless we unite the people and really make that change from the bottom up. There are a couple of things within Act 48 that we could push on our legislator to do right away. They're called the Mullins triggers. And they were 3 things that were written into Act 48 and into the Green Mountain Care Board that if they happened, we would have to go back and look at Act 48 in a different way. And we do have legislators that were pushing on the larger legislative body to enact those and to begin that process. With the pandemic that's happened, that's probably going to get derailed for the rest of this session, because a lot of our energy is really going to be put into making sure that people are okay and that healthcare is given to the people who are suffering with the coronavirus, and it really is going to derail the system. But what we can do, knowing that we have another election coming up, is make sure that we continue to get healthcare advocates into those seats, and we continue to unite people to push for that to happen so that those Mullen triggers do get named and we do go back towards funding Act 48. The Green Mountain Care Board has not done what it was supposed to do, which was move us towards a single payer system. Has it slowed cost growth? Maybe a little, but I'm sure that anyone who is using the private health insurance system felt the 11% increase from one of our, I can't remember if it was MVP or Blue Cross Blue Shield, but one of our local insurers. That's not okay, and it can't keep happening. And and I don't know because I just saw it as I was coming into this meeting, but there are predictions now that because of the cost of coronavirus, private health insurance could go up by up to 40% next year. We can't afford that. We have to do something different. And therefore, we've got to find a way to unite our activist community and our legislators who are really, truly going to fight for this.
David, does that, so one thing I want to say is I think that this really shows where Tanya, just to folks in general, the knowledge that Tanya and Mary both hold on this issue, because of the work they've done on the ground, is really important for us to recognize that we all have that power to learn that information. David, does that answer your question?
Yeah, that, I was curious to see what direction individuals, candidates are willing to take us forward. And I do have a follow-up question, if I may. May I?
Absolutely.
Yeah. Now, I understand the position that the insurance companies are the bad guys. Is it possible, in your perspective, that they could be co-opted rather than have them, dig in with a lot of armor? Here's what I see. If we go to statewide or nationally, if we go to some sort of universal coverage, I don't think the state of Vermont has the workers to process all the claims. The insurance company folks do. They do it really efficiently. The problem is that they decide who gets paid what and how much. Is it possible, in your perspective, to try to co-opt the insurance companies and to, give them some sort of vendor role, as long as they're not making the key decisions?
May I give just a normal voters instead of candidate perspective on that?
Yes.
Thank you. So I just wanted to say that that's a common question that we encountered during the passage of Act 48. It's also a question that people have asked nationally and internationally. And here's the thing, is that my personal opinion is that no, it's not possible, because it challenges the very structure of insurance companies. I do know that in Vermont, Blue Cross is considered technically a nonprofit. That does not mean that they don't make a profit. They are tied in, as you would know, as a medical care provider, to the Blue Network nationally, which is a for-profit shareholders company. The reason that it would work is because if the insurance companies are relegated to supplying some other kind of insurance, for example, in Europe, you can get insurance, although the companies all have to be true nonprofits, I might add, for like having a private room if you go to hospital, or having cosmetic, and when I say cosmetic, I mean not medically necessary cosmetic surgery. Here, if we took all of the actual health care away from the insurance agencies, all those people you're talking about who are processing claims and going through the rigor of doing this whole thing would need new jobs. Therefore, they would be retrained for the state. The other thing is that we wouldn't, and they would be retrained for other things, maybe x-ray technicians, maybe lab specialists, whatever. There is a retraining provision in Act 48. The important thing is that it would cut down, by having the state handle it, on the numbers of persons that were required to do those tasks, because you would no longer have the whole decision-making process. You would no longer have the claims forms with umpteen codes that vary from company to company and doctor to doctor. So like, what's the right code for a procedure in one company isn't in the other. It would all be, you swipe your card, it goes to the state offices, the department in the state who employs workers to handle these, process them, and your doc gets paid. Not only that, the doctors would save money because they would not need the extensive office personnel. And I know it sounds like I'm saying we're cutting out a lot of jobs, but we're also retraining people for jobs that are really needed. We all know that we don't have, or at least I've been told, that we don't have enough personnel in various departments of our hospitals and clinics. We also did a study through the AMA when we were first working on Act 48. And it was surprising how many physicians said they would move to Vermont if Vermont had a single payer universal health care system, which could in fact really help because I think we don't have enough primary care physicians now. The other way that it would save doctors money is that when you look at medical malpractice insurance, and this actually is the same argument for employers saving money on their workers' compensation insurance. When you look at that, in terms of workers' comp, for example, a third of the workers' comp premium that an employer pays goes into a reserve to pay future medical expenses of any worker injured on the job. Now, there wouldn't be any future medical expenses because everything is covered whether or not they were injured on the job. So the only compensation they would get for being injured on the job would be actual loss of work time or pain and suffering. You wouldn't have to worry about the medical expenses. Similarly, for medical malpractice, if we had a no-fault medical malpractice system like Australia does, we wouldn't have the extensive litigation, we wouldn't have the high premiums, and it's more effective because the claims get settled more quickly and people don't have future medical expenses on those claims either because their medical care is taken care of. So all that the arbitration panel is working on is lost wages or pain and suffering. And I'll stop there and let other people contribute.
Thank you.
So I would say that the insurance companies have not proven themselves to be capable of such a thing, in that they are just not doing what is best for the public good for the most part. And we really do need to make that change. And so I do think there has to be a transition. I think there will always have to be a transition. And so in order to make it work well, and I do think you have to retrain employees because we do not want people losing their jobs either and not being trained or moved into another position. So we have the workers. We just have to, they would just change to a different type of work with a powerful union, actually, and really have the opportunity to have a better workplace environment because they'd be working for our state government if they are doing those kind of claims. And be able to and not have to turn people down in the same way. So while wouldn't be making the decisions, I would be concerned that they still ultimately would make the decisions. And just actually today I had a tele appointment, which I now believe should be how we do all appointments that where you don't need to be poked and prodded, because it was excellent. And the doctor looking over, I had a test had been denied that I needed, that had been denied 3 times. And he looked at another test that I had and said, "Oh, I'm not worried about this test at all, but this will help us get you the test you need, because absolutely, if this is true, then you get this other test." And there's almost definitely nothing wrong. It's just that I have to have this test done. And so just having recently had my own experience of the insurance company denying that, I just don't see them as, I would be concerned that we'd be using those same doctors that have been denying claims for so long. And even with a strong system, we would have trouble weeding out the bad practices. I don't know if that helps at all, David.
It's my favorite thing about the economic study that I mentioned is it actually includes funding for retraining of all the people who are not necessary in a system where there isn't all that administrative overhead. The one person that I think of a lot when we talk about insurance industry executives being involved in Medicare for All is Wendell Potter. He used to be an executive with Cigna, and he's now a very loud advocate for Medicare for All. And he just does a really great job talking about these pieces, about how he's come to change his view, and as an insider from within the insurance industry, he's got a lot of really amazing things to offer. I know that Rights and Democracy was hoping to bring him to Vermont for a speaking tour in the spring, but that may be shifting, changing, time, postponed. We don't really know given everything that's happening right now, but he's definitely someone that's worth reading or looking at some of his interviews, because he does talk a lot about the transition from a for-profit private system to a non-profit public system. And the other person, I forgot to mention and I can't believe I forgot to mention this as someone who has a small business myself, is the small business owners and the people who currently pay astronomical sums to insure their employees, if they can even afford it, would save huge amounts of money as well. So I know we talk in the state of Vermont a lot about how to support small businesses, and one way we could really do that would be by enacting universal health care, because it would ease the burden from them to be trying to pay for their employees to have insurance. And I'm a sole proprietorship, so it's not something I have to worry about except for my own insurance. But still, it would be for some of our small businesses that currently can't afford to provide insurance or pay huge sums of money, it would ease that burden on them and make it easier to start a business.
Thank you.
Thanks, David. We have another question coming up from Lori. And Lori, if you want to, so David, we're going to bring you back down as not a panelist so that we can have Lori come up. And if you want to ask, or if you just want us to read off what you're talking about, that would be fine as well. You can let us know and we will bring you up. But we do want to just correct the information about workers' comp. The pain and suffering is for medical malpractice, not for workers' comp. It was just a misspeak, and it's totally fine. We all do that. And then
on the coding question, we have been told specifically by OneCare when they were down here at a panel in Bennington, that the different insurance companies do in fact have different codes. And although I realize that federal regulations prohibit that, if they have one word different, they can justify having a different code. So that was where I was coming.
As someone who provides healthcare as a social worker, I can absolutely affirm, and particularly right now during the COVID-19 crisis, there's been a lot of shifts in telehealth, and every single insurer requires that you code that and label that differently. And some insurers are requiring that you use one platform, while another insurer requires that you use a different platform. So as someone who provides healthcare, I can absolutely affirm that it is a nightmare to navigate through all of the different insurers and what their requirements are and how to credential with them so you can even bill them. It's really illuminating to be on this side of navigating that system and how absolutely impossible it is. There's days where I spend many unpaid hours just trying to figure out what a specific insurer needs from me so that I might get paid $37. And it's really challenging to navigate those little pieces. And there may be federal laws that says that that's not okay, but it happens every single day. And it changes every single year, every single quarter. So what worked last month might not work this month. And so then you have to learn it all over again. It's nightmarish.
So I would say that, first of all, I just want to apologize. That was Lon and not Lori. Our screen, it's very light blue, the name, and so I just did not see it. I apologize, Lon. And I want to say that thank you, Tanya. And I think that that's part of the problem, right, is that there are loopholes in all of these federal laws. And so when we're talking about the insurance companies, we are talking about an ability to go around the laws, even in terms of coding. Because of the way our law works, we have doctors coming up with the correct code, not necessarily the correct diagnosis, to get the testing they need, because the coding is indicating an access to training that otherwise is not true, right? So I think that that's extremely important for us to remember, is that these federal rules have so many loopholes that it makes it very easy for there to be slight shifts to slight that are allowed because there's one word difference or for other reasons. And so while I really just think that CEOs and health insurance companies are in it for profit. And it's something that we have to be really careful about when we're talking about all of this in that way. I'm wondering if there are other questions. I also want to mention that Tanya has the economic study that she was referencing earlier. And so if there are folks on this call, we will get it out to you. We might even, if it's okay with Tanya, maybe we can send it out to all of the attendees, all the people that signed up to attend this event, because they may be watching live stream, they may be watching on the attendees.
I included the highlights, and I'd love for that to go to everyone. The full economic study is about 280 pages, so I didn't want to burden everyone with that. But I included a 22-page highlights. But if anybody wants that full 280 pages, feel free to reach out to me, and I'm happy to get it to you. I just didn't want to make everyone look at that.
So I feel like the 22 pages is what we can get to everybody, and then we'll send it out in an email. We might send a resource list out to everyone who signed up for this event. If you're someone who didn't sign up but you're watching on the live stream, then make sure that you connect with us on the live stream that you also want it. And Jacob, who is our field director again, he will make sure that he gets your information so that he can get you that information. Now we have a question from Lucas. Also, Lucas, you can turn your camera on, and then we can see you, which we would love to see people's faces. We're also isolated. So oh, you're muted, just FYI. There we go.
Hello.
Hello.
So I was wondering, I just had a question about if Vermont switched to a single payer system, how that would work, as far as would it cover if you needed to like see a specialist out of the state, like down in Massachusetts or any of our neighboring states?
So anything that I was promoting would allow us to do that, because first of all, in the southern part of the state, we often have to see healthcare providers that are, Dartmouth, and in Northampton we also go to Boston. Also, my personal treatment, like I mentioned earlier, was at the Cleveland Clinic in Ohio, and I went everywhere else, so I may not have been diagnosed without that type of care. So anything that I am going to put my name behind or promote is going to make sure that we can see out-of-state providers. And I know that you're from the Upper Valley, so that also would impact you extremely negatively if you could not see providers. And I don't mean like we'll just make an exception for Dartmouth. It has to be that people can still choose the healthcare they need. And what I have found is that, like in Cleveland, that they'll take Vermont Medicaid if you have private insurance as well, because in case they get a denial from Vermont Medicaid, they just want a backup. But I think if that's our system, we are in a little bit better of a place. Tanya?
What a great question. As someone who had to seek specialty care first at Dartmouth because my private insurance wasn't covered by anyone in Vermont, and then in Massachusetts because they couldn't figure it out at Dartmouth, I absolutely think that that's vitally important. And it's one of the primary pushes around maybe looking at a regional plan that would increase that risk pool, but I don't think we can do it. if we don't allow people to see the doctors that they need to see. Again, we're a small state with big borders, and lots of our healthcare crosses those borders. And sometimes specialty care can only happen in certain specialty clinics, and we can't offer Vermonters worse healthcare because we want to give them better coverage. We have to do both. And that's one of the primary financial arguments, is that that becomes very difficult. It is navigating all kinds of federal waivers, which is why I think it makes sense to explore possibly regional options, as well as what it would look like in state to allow that. And the studies for that, to kind of get a feel for what that might cost and what that might mean for Vermonters, haven't been done. And that's one of the things that would happen in, again, those Mullins triggers that I indicated would force those studies, so that we could say, to do this in only the state of Vermont and guarantee that you have healthcare if you have to go to Dartmouth or if you have to go to Cleveland, it would roughly cost this. To do it regionally, it would roughly cost that. And obviously they're estimates, but we can't enact a system that continues to do what we're doing now by saying you can't have the healthcare that you need. And if the healthcare that you need is in Cleveland, then you need to be able to get that healthcare, period, end of story.
All right. Yeah, I think that answers that question, because the single payer system certainly makes sense, and like support that. I just had that question about, if you'd still be able to seek out the care that you needed or wanted.
Thank you for bringing that up, because I actually think there's a huge fear about that. And it's a fear that in large part has been really set upon us by the right-wing messaging, but also it's a legitimate fear if you're living on a border, in the state on a border, right? But that fear has been, if you have government health insurance, you won't be able to choose your healthcare providers. Well, first of all, that has not been my experience, and I do have Medicaid backup, and I can only see people that take it. I have been able to choose my providers. And second of all, I think that Medicare is one of the best ways that we have healthcare right now. And so that's why Medicare for All, I think, is such a strong way to be presenting a universal healthcare system, is really using a system that already is working and broadening it. And I really, on a federal level, I really love Bernie Sanders' plan, because it really does push us from. It does go like, in the first year, this many more people will be covered. And this next year, this age group will be covered. So we're actually are incrementally moving towards that system, and we're just expanding, except that we are in an everybody in, nobody out system in this scenario. And I want to take that minute and Lucas, do you have any other questions before I go on to the next subject?
I don't think so. I think that covers that.
Cool. Thanks so
Brenda,
much.
can I just add that on a federal level, like what my experience has been is that I here have insurance that actually comes from New York and doesn't cover a lot, because my husband's company is actually based in New York. And so my insurance actually doesn't cover a lot of Vermont providers. They're out of network. And so I have to travel to see doctors in many instances. And if we move to a federal level Medicare for All system, there is no out of network. The network is simply doctors. And so the fear mongering around you won't have choice is just that. There will no longer be out of network physicians. The reason I had to go to Dartmouth is because that the one allergy practice in Vermont didn't take my insurance. And so I had to take time off of work. I had to travel to New Hampshire, and I'm up in northern Vermont in Chittenden County. So that's it's a 2-hour plus drive for me one way. And that goes away if every doctor is in the Medicare for All network.
So I kind of want to take the second to talk about disability rights and how this plays into this issue. So we have a serious problem with healthcare where it comes to disability rights. Different people are being covered in different ways according to what kind of insurance they have, and sometimes and often not getting the care that they need. And so as someone who has, for many years, when I was 12 years old, I helped my mom become a sign language interpreter. By mean help, I like finger spelled and and she learned how to fingerspell quickly because of that. But it's something that has been not just in my purview philosophically, but in my purview learning about it as a child and growing up, is that what kind of healthcare you need. Everything from having access to an interpreter at a doctor's visit, at an emergency room visit, so that you understand what's going on, so that you know, so that you can be talked to, whether you're needing a sign language interpreter or another kind of interpreter, whether you need an advocate with you, if you have special healthcare needs and you need to have a respite care provider, or your family needs a respite care provider, or just the treatment that you need. I think it's essential that we have part of the reason we need everybody in, nobody out, is because if we don't have that, then there are people who are left out. And not only that, but in the previous system, which I think we're at risk of going back to, in the previous system, there's a huge problem, right? In the previous system, we had a pre-existing condition, so that meant people with disabilities frequently. We also had people who had like lifetime limits. So we want to make sure that the limits are not lifetime limits. We want to make sure that we aren't creating a system that can be changed at the whim of the next legislature, right? Of the next Congress. We want to make sure that we're creating a system that will grow both our economy and our health as a state and as a country. And I want to add that when we are healthy, we are able to work. When we are healthy, we are able to contribute in whatever way we're contributing, whether it's as a volunteer, whether it's as a worker. But the cost burden, like I've said before, is huge. And, for me, like Tanya, the moral issue is my driving force, of course. So I think it's extremely important. Also, I'm just going to let Tanya talk a little bit about the language equity issue.
Yeah, this is a language equity issue as well for people who maybe English isn't the most comfortable language to them. When people are struggling or sick, it makes the most sense to speak to them in the language that they're most comfortable with. And in my practice, if I want to use an interpreter, I have to pay for that and hope that the insurance company will reimburse me enough to cover it, because I would never charge someone to use an interpreter. That would be wrong, immoral, hopefully illegal, but I don't have that much faith in our systems. But that is a challenge as well, because that's difficult. Interpreters deserve to be paid well. It's hard work that they're doing, particularly well-trained medical interpreters. And for me to not know upfront whether or not I will be reimbursed or will be reimbursed fairly for paying for that, usually as someone who's in a private practice out of my pocket, is just, it's not okay. And we have to do better for the people who are seeking our services, as well as the people who are providing them, to ensure that they have equitable access to care.
Right. And I would also like to say that one of the big things about a single payer universal system is not only cutting down on the privatization of our healthcare through insurance companies, but also regulating not only the pharmaceutical, but the medical equipment manufacturers. So this really impacts disability rights. Because if you're somebody who needs an electric wheelchair and you need one of the cushions that is an air cushion that goes up and down to try and make sure that you don't get any sores while you're in it, that is an incredibly expensive piece of equipment. And it doesn't have to be. Because if you go to other countries, it's not anywhere near as expensive as here. It's about a quarter of the cost. And that's because the other thing that happens in other countries with medical equipment, in addition to regulating prices, they have global purchasing power. So if we were to have, Canada has global purchasing power. That's why pharmaceuticals are so much less expensive there. Medical devices are also less expensive because if you've got the government, of course, the federal government would be the best, but even a state government saying, here's what we're going to pay for these devices, whether it's a walker or a cane or a wheelchair or an oxygen pump, I'm just, whatever it might be that you need, then we could get them cheaper and provide them to people instead of worrying about whether their insurance will pay for it or not. And since their insurance probably doesn't pay for most of it, whether they can actually get what they need to live a life of dignity. And I think that's a really crucial aspect to this whole idea of improved Medicare for all.
So we've touched a little on what can be done in Vermont. Keep asking questions if people have them. We will bring you in to answer them. But we've touched a little bit on what we can do to create a Medicare for all system in our state. And I would love to hear a little bit from Mary about where we're at with that process, because she's the one working directly with a group on that, if I remember correctly. And
Yes.
So I'd love to hear where we're at.
Yes, thank you. And things have been a little delayed in terms of getting our group together because of this pandemic crisis that we're in. But the goal is, there's currently a healthcare bill introduced by a couple of legislators that are supported by RAD, Mari Cordes being one, who's a nurse, who you all may know, and Brian Cena being the other, which is basically a redraft of Act 48, only it doesn't have all the stuff about the Affordable Care Act in it. And the reason I think for that is because of the fact that the Affordable Care Act has been amended so many times. I mean, the Act 48 has been amended so many times to include various provisions of the Affordable Care Act and of One Care and all kinds of other sort of intermediary kinds of programs that people thought might work to reduce healthcare costs and improve healthcare, that it would be really difficult to trigger those things in the act that require the financing on a universal basis. And so a lot of people thought it would be easier to basically rewrite the act, which we've talked a lot about the things that are in it, including the fact that it declares healthcare to be a public good and a human right, and including the fact that it provides for any medically necessary treatment. And there's a whole definition of medical necessity, which of course includes our whole body, it doesn't exclude our eyes or our teeth or anything else. And it also would provide for any kind of long-term care or medical devices, because those would in fact be medical necessities. What we're trying to do is get a committee together of folks who have spent years working on Act 48 and other people who are interested and who are experts in the financial field as well as the healthcare field. And we're trying to represent this to Vermont as improved Medicare for all. And we feel that we would have the people power to do this. One of the other reasons to rebrand it is that a lot of people, when you talk about Act 48 today, are like, no, we already tried that and it didn't work. We still pay tons of money in insurance, and no, we're not going there. What it is that we need something new to engage people and to make them understand that what we're talking about is not, not exchanges with insurance, and is not One Care where certain things are covered for certain people. what we're talking about is universal single payer health care. So hopefully we will get back to rewriting that bill that's on the wall right now and getting the people power to actually get it passed in Vermont. And hopefully we can get a federal thing passed too. But as I said before, there are countries smaller than Vermont that make single payer universal health care work because, as Tanya and Brenda pointed out earlier, the actual cost of our health insurance is driven sky high by costs for advertising, costs for donations to lobbying funds, costs for layers and layers of bureaucracy. Our hospital, our small hospital here in Bennington, has 2 floors of offices that do nothing but process insurance claims. 2 floors. That's outrageous. It's a small hospital on a relative basis compared to other hospitals in the state. So what we're trying to do is get people together and develop the people power that we used for Act 48 to get that pushed through. And you know, it's not impossible, because I'm sure all of you who were involved in Act 48 will remember that, and I was with the Workers Center at the time, that when we were trying to get that through, everyone told us it was politically impossible to get that passed. But the people rose up, and the people stood together, and the people voted, and the people threatened to vote legislators out who weren't in favor of it, and the people won. Unfortunately, the governor fell down on the job and never implemented the financing, and so here we are. But that's what we're hoping to accomplish within the next, I'm going to say, couple of years, because this next year we all know that people are going to be preoccupied with staying alive during this pandemic.
Mary, thanks for bringing that up. I spent many days yelling on the State House lawn to help get Act 48 passed. So I definitely can relate to that. People rising up. The people are what's going to make this happen. We cannot do it unless we all come together and fight for it. And it's going to be a fight, because the pharmaceutical companies and the medical device companies and the insurance companies, they have endless supplies of money to throw at ad campaigns against this and to throw at messaging against this. And that's scary and it's daunting, but if we come together as the people, we have far more power.
Yeah, I want to just say that thank you for bringing that up as well, because it is us rising up that makes change. And that's true with every issue that we're talking about here. And we have to care beyond the one issue. So whatever, because the problem is that they all intersect. And if we don't work on all of the issues, then we're working on none of the issues. And we know that all of them disproportionately impact people who are struggling. And we know that people who are struggling are going to be in a very, very hard place following this epidemic, this pandemic. And so we have to work even harder than we did before. I mean, one of the big challenges as a candidate is how we go forward as candidates. And that's true with any business, right? With any person advocating on any issue, it's how we go forward. And really in the last few weeks, one of the things that I've come to is how crucial it is more than ever right now, because coming out of this, we're going to need a system change if people are going to survive beyond the health scare. If they're going to survive to have jobs, to have insurance. So many people rely on their jobs for their health insurance, and their jobs will be gone now, evaporated overnight. And so if we actually want it to change, then we're going to have to do what we need to in order to fight for these issues, to fight to elect progressive candidates, to ensure that, and grassroots candidates, to ensure that we as people are rising up and showing up in the State House. But again, we can do this work from our homes. We can do this work in our local communities. It can be hyper local if that's what you need to do. And so there is no shame to people who have to fight that way. I was an only parent of so we just lost an interpreter, and I'm hoping she comes back quickly. I don't know what happened. So I just want to say that really quickly. So anyone who, I know that there is one person on here using the interpreter. So it's Val. I know her, and you know that my mom is a bit of a Luddite. So she probably accidentally cut herself off, and hopefully is coming back soon. So I don't know where I was in that statement, but I wanted to just make sure I addressed that right away. So I think that what's really important for us to understand is how crucial it is that we're fighting right now. And once we're able to find a routine in this temporarily new normal for all of us. I mean, I wake up every morning and I have this strange, Becca Ballant wrote about both panic and a monotony happening at the same time. And that's exactly what I feel. I wake up in the morning and I think, okay, I have a lot to do, and I'm not leaving my house again today. And I am on day 14 right now, and I checked before I got on here so that I would know. So I think that, and we have many more days to come. And so we have these moments, some of us do. I mean, if we're homeschooling a kid, we may not right now, but we have these moments to take 15 minutes to make phone calls, either for a candidate or for an issue. We have moments to maybe do postcards, although there's a whole procedure in which you have to do that to make it safe to do a postcard, including like not touching it for a certain period of time before you mail it, so that if you are infected. So talk to us if you want to do postcards. We need to make sure that we're doing that safely. To do, I mean, you don't want to be an online warrior. It's great to fight it online, but that's not really where the biggest work happens. Now, in this pandemic, it's a little different because where everybody is online, and so that's the way you fight. But it does include interacting with your legislators. I mean, very kindly right now, because they're working real hard right now, and it's really important to do this in a kind way, but letting them know how important it is to you that Act 48 come back in a meaningful way, or that a new healthcare for all bill come back in a meaningful way, and how this pandemic has really made you see that. So I also am getting a note right here. You know, I'm going to get to things you can do for Tanya or I at the very end of this. So we want to ask one more time if folks have any questions, and then we're going to each say something in closing, and then we'll actually talk a little bit about how we don't want our democracy to fail in the process of this.
Brenda, can I just add to what you and Mary had said about the failure of Act 48, Mary, and I say failure with air quotes because Act 48 didn't really fail, but that is the conversation. And Brenda, what you said about fighting for bold progressive change, the quote unquote failure of Act 48 is an illustration for why incrementalism doesn't pay. We've got to fight all in for everything, because if we fight for a little because someday we'll get there, we end up in this position we are with Act 48 where nothing has really gotten any better, but we did a thing. And so I think it's really important that we fight for candidates that are going to unwaveringly demand bold progressive change. And no, that doesn't always mean we get every little thing we asked for, but we don't compromise at the beginning. We negotiate along the way to fight for real change, not just passing a bill that makes us feel good that we did something.
Yeah, sorry, I was trying to address the interpreter issue. So, yes, I don't know what happened. My mom has disappeared, so our interpreter has disappeared. What we will do is figure out some way to make sure that in the end of this video, we have some way to sum up what has happened in these last few minutes that we don't have an interpreter. So I know that Val left, but in case you're watching on the live stream, I am very, 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 very sorry. This worked so well for so long, and I want to just report that Val did tell me that the interpreter was working, that it was working. So that's great because it's so important to me. And hopefully we can get my mom to do it again because as Tanya was saying, the cost is imperative. Cost is struggling. So, okay, Rick, my mom says, our interpreter says, our computer went black. I guess the battery died. Rick is working on it now. So she should be back in a second. So I really am sorry. Okay. So I want to let Tanya go. Oh, there she is. And my stepfather, Rick. We can wave to him. So she's back, and we're going to get her on for interpreting, but hopefully not that way. Okay. So I'm also going to just let Val know in case she left because she didn't have an interpreter. Here we go. Sorry, one pause. Mary, why don't you give us your sum up of where you're at?
Okay, thanks. Thanks very much. I would like to thank everybody for joining this because it's what we really need is to support and promote folks who are willing to fight for our health care. We unfortunately had a governor at the time of Act 48 who was not willing to take that risk. And so we need to elect the people now who are willing to make a commitment to us and actually follow through on what they know is the right thing to do, and to actually fight for the people that are going to get them elected and to continue that fight in the State House. And we, the people, are the ones who will put them there. And we are the ones who will not put people there that won't fight for our health care. Health care is a human right. Healthcare is something that we all need now more than ever, and we don't need insurance companies to profit off of those who are dying in these terrible times. What we need is candidates who will do the right thing and fight for our healthcare and know that it's a human right. And thank you both.
Go ahead, Tanya.
I just want to make sure it was my turn. Thank you, Mary. And thank you for all the work that you do. I know this issue as a personal issue, as someone who has been unable to seek or afford the health care that I need, as someone who was uninsurable before the Affordable Care Act. I know this as a work issue, as someone who sits with people on the edges who can't get what they need, and and as someone who helps them massage the systems to best meet their needs. I know this as a systems issue. These are not individuals that are failing. These are systems that are failing us. I know this as an economic issue because we pay more than any other country for less. And most importantly to me, I know this as a moral issue. It is a paramount issue for us to fight for. It is what is right. It is what is just. And it is what we must do. And we take that fight to the local level, to the state level, and to the federal level. And we don't have to do it all. We do what we can, but we must come together and we must demand that healthcare is guaranteed as a universal human right for every person. And we must do it now.
I want to thank both Tanya and Mary for coming. I want to thank Judy Kanoy for interpreting and volunteering her time. And I want to thank the Progressive Insider and Carrie Barber for helping us by utilizing their platform and their services, and everyone who came to attend today. You can also join us for activities that are just for fun this week. Again, we have Cooking with Ajna. We also have 2 other events on Thursday. We have a tea, you can sit down and have tea and conversation, and also a support group for homeschooling parents. And then we will also have some fun events over the weekend. But in addition to that, we have an overdose crisis, opioid epidemic, event next Sunday. And also we have a community conversation in Bennington next Sunday as well. And I want to just highlight that for a minute. We are going to be doing community conversations throughout the state in as many towns as we can that do have to be online because of what's happening right now. And so if you're in a community that we have not reached out to yet or that you're unaware of us reaching out to, please reach out to us and let us know so that we can make sure that we create a conversation there. Because what we want to know is what's happening independently in each community with healthcare, with the economy, with other crises that are happening, and climate change as well. It's extremely important. So please do reach out to us. And then finally, once again, please donate. I think Tanya and I are both not making calls to people to ask them for money because it just is not okay right now. And so we're asking you to contribute so that we can keep paying our staff. Jacob, I don't know where Jacob is, but he would like to continue to be paid. And he also has a partner who lost their job and a baby. And so it's extremely important that we all keep going. So I think that it's hard to remember that, but it's just as important as it ever was. And so if you're able, please do. We will put the contribution link up, and when you donate, you're giving to both Tanya and I. So that's also an awesome way to support two candidates with progressive policy. And finally, what I want to say about healthcare is that it isn't when you get sick that it should become important. It should be important every step, every day, not only because of the people in our community that need us to support them, but because our entire system relies on the people who are who are living just below, just at, or just above the margin. And we need people to be healthy in order for us to be okay. In addition, the moral issue is huge. Healthcare is a human right. We know that. We know that when you all stand up, when we all rise together, that's when we're going to see real change. And so we need you to rise with us today. We need you to support this change. We need you to follow it from when it's presented all the way through to implementation. Because as has been pointed out several times today, sometimes it gets presented, we did a thing, and it does not get implemented. That's what we saw, and we need it not to happen this time. And so please do what you can, from helping to elect progressive candidates to fighting this issue and fighting the other issues with it, making sure that climate change is at the top of your priority list, because healthcare being a human right relates directly to climate change issues, and ensuring that your voice is the one that's heard, that your story is the one that's heard, because we are not making change as elected officials alone without you. And those of us that are in office that understand that in order to make real change, we have to be able to step back from the podium. We have to be able to step back from the microphone and let you tell your story. That's when we're going to see real change. That's when we're going to see it. And everyone on this panel today started as somebody who was just fighting for issues because it mattered to us. And that is all of you out there watching today too. So I implore you to be part of this movement for change, to be part of a movement that intersects racial justice and climate justice and healthcare justice and gender justice and progressive drug policy and education justice and all of these issues. They all come together. Immigrant justice. None of them is important alone. So fight. You can fight where your heart is the most passionate, but make sure that you are in it for the intersectional systemic change that we all know is so important, so that we can have a Vermont that's strong enough for all of us. Thank you all for coming. We're all going to wave now. Thank you.